What are the causes of high blood pressure and how can I manage it?
Hello and welcome. Today, we're going to talk about a common health issue that affects millions around the world: high blood pressure. We'll delve into what causes it and how we can manage it effectively.
What is high blood pressure?
High blood pressure, or hypertension, is a condition where the force of blood against your artery walls is consistently too high. This can eventually cause health issues, such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries.
What are the causes of high blood pressure?
There are two types of high blood pressure. 1. Primary, essential, hypertension. This type has no identifiable cause. It tends to develop gradually over many years, often due to a combination of genetic factors and unhealthy lifestyle choices. 2. Secondary hypertension. This type is caused by an underlying condition. It tends to appear suddenly and cause higher blood pressure than primary hypertension. Conditions that can lead to secondary hypertension include kidney disease, adrenal gland overactivity, or the use of certain medications.
What lifestyle factors contribute to high blood pressure?
Certain lifestyle factors can increase your risk of high blood pressure. These include lack of physical activity, an unhealthy diet, especially one high in sodium, being overweight or obese, excessive alcohol use, tobacco use, including smoking and chewing tobacco.
How can I manage high blood pressure?
Managing high blood pressure often involves making lifestyle changes. Here are a few steps you can take. Exercise regularly. Physical activity can help lower your blood pressure and keep it down. Eat a healthy diet. A diet rich in fruits, vegetables, whole grains, and lean proteins can help lower your blood pressure. Reducing your sodium intake can also be beneficial. Maintain a healthy weight. If you're overweight, losing even a small amount of weight can significantly reduce your blood pressure. Limit alcohol and quit smoking. Both of these can raise your blood pressure and damage your blood vessels, increasing your risk of heart disease. In some cases, lifestyle changes may not be enough, and your doctor may prescribe medication to help lower your blood pressure. Understanding the causes of high blood pressure and taking steps to manage it can go a long way in maintaining your health. It's always a good idea to talk with your healthcare provider about your blood pressure and any concerns you may have. Remember, managing your blood pressure is a lifelong commitment, but it's one of the most significant commitments you can make for your health.